Hey everyone, it's Dana and
Amy.
and we're so glad that you're spending your Thursday evening with us at Live in the Lounge. We've had a pretty busy week between last week and this week, so we are getting ourselves back in order, getting everything together. We had a great show last week with Lori from Zen Sweat Den talking about different ways to help boost your immunity naturally. We actually had a really great conversation, and she does still have that takeaway if anyone's interested in what we spoke about. Maybe if you missed the call or you were interested more so in having notes from the show, so you can always email to zensweatden@gmail.com. So anyone that's here, please make sure that you say hi in the comments. We are so excited to talk about this fun and interesting topic. We're a little bit what was I going to say? We're a little bit I don't know. For a while, I was kind of like, is this a little bit risque to talk about? But I've had a relationship with Dr. Bawa for about a year actually now. She is a board certified doctor of osteopathy. She's an emergency room doctor, but more commonly, she is the name and the doctor behind Bawa Medical, which is located here in Boca Raton. One thing that I love about her practice and what she does is that she is very into the healing and benefiting yourself from the inside out. So, and trying to do it as naturally as possible before going to other things. And an example would be like when I first went to her, I was like, I have these lines and I have this sag, the typical like, oh, I'm getting older. And she's like, instead of starting with fillers, let's do something. And that's why I did the profound microneedling and radio frequency, because it helped from the inside out naturally to produce the collagen and the hyaluronic acid and all the things that our skin naturally makes, instead of doing the injectables and stuff like that. So it was super important for her to try to get me to heal, to restore myself from the inside out naturally before going to those fillers. So this is the first time Jamie's speaking with her. So I'm super excited because I keep talking Dr. Bawa, Dr. Bawa, Dr. Bawa. And tonight we are going to be talking about something that is not to do with our face. It's to do with down there. Oh, you can't see my hand. So it's like a taboo. We're going to talk to Dr. Bawa all about this. But it's just an interesting topic. As we get older, things start to sag, things happen. It's out of our control. And no one thinks about the nether regions. So I am excited to introduce Dr. Bawa right now. She is our next guest on Live in the Lounge. I'm going to bring her in right now. How are you?
Hello, hello. Thank you for having me.
Oh my gosh, my pleasure. James, Dr. Bawa, James.
Yay, so good to see you.
Good to meet you finally.
I know.
Even if it's virtually.
Just for now. Trust me, I'm coming to Florida to see you.
So, Dr. Bawa, thank you so much for being here with us tonight. I'd love if you could tell us a little bit about yourself and then a little bit about your practice.
Okay, thank you for having me. It's a pleasure to be here with a cool bunch of women. Cheers to us. Here's my Pellegrino. Cheers to us. So I am a Boca Raton-based cosmetic surgeon, but cosmetic surgeon is almost confusing in some sense because I try to be more non-surgical than anything. So whether it's aesthetics, whether it's sexual health, I really try to be as non-surgical and as non-invasive and rejuvenative as I can be. And that's really how my journey started. I started out in emergency medicine, did that for many years, but always had an interest in aesthetics and cosmetic surgery, transitioned into that. as a hair surgeon and looked into multiple ways of rejuvenating hair and, hair restoration, both surgical and non-surgical. And that sent me down the path of PRP and lasers, because, people don't realize, but lasers can also put hair on our hair, not just on our head, not just take hair off our body. So, I became not only a hair transplant surgeon, I became a laser surgeon. So one thing evolved into another, and next thing you know, I was getting more and more into rejuvenation. And sexual health is something that was a very unexpected byproduct of that, because I realized that I could do so much, so non-invasively. And then the more I did, the better I got, and the more people started coming to me. So now I'm known more for my non-surgical facelift, the profound or extensive skin rejuvenation, and then not even so much for the hair anymore, more for, intimate wellness. So it's very interesting how that evolved.
It is. It's very interesting. So Bawa Medical was founded, how long have you been in your facility?
Since September of 2019.
And it's a beautiful location right in Central Boca. And you focus on regeneration and revitalization from the inside out. So I was talking to Jamie about how what our topic was going to be, and she's like, we're all for it. We need to talk about this now. So I'm going to let Jamie take over the next questions.
I'm pushing Dana to the edge of what people want to really hear and talk about. So, obviously everyone spends a lot of time on how they look on the outside, and you talk a lot about how do we fix from the inside, but we don't spend a lot of time focusing on what happens to a woman's body as they age outside of their face and maybe their neck and some other parts. So tell us a little bit about what happens to women in their most intimate places as they age.
Okay, well, you're right, because it's one of those things where it's taboo, even in today's day and age, to talk about certain things. Everybody's having sex, but nobody wants to talk about it. And they certainly don't want to admit that they're having bad sex. That's even worse. So God forbid they actually talk about it. And women talk to their female friends to some extent, but I find that even then, there isn't that level of honesty. Sex in the City is a unique concept. I think it's very utopian, because that's what you think a friendship should be. But how often do we really talk to our friends honestly on that level? We really don't. So this is, where I come in, because as you age, things that happen in your face are automatically happening down under as well. For instance, Dana had the non-surgical facelift with me with profound radio frequency, because she wanted to arrest, and she looks good too. She wanted to arrest the decline before it became very obvious to everyone. And she got it at the right time. Now, what happens is the same proteins that are, sagging in your face are sagging everywhere in your body. That's why as you get older, you have more cellulite. You feel that, the skin around your knees is more crepey. It happens diffusely. We just focus more on this because this is what the world sees more than anything else. So if you think about it, and I'll get a little technical, but I promise not to get too technical. But this is what happens. I often describe it as, a beautiful old building. The foundation of the building is sagging. You don't want to condemn the building, but how do you fix the floor? Why is the floor sagging? Why is that foundation going under? So basically, the three key components of our skin that make it look as good as it should are elastin, collagen, and hyaluronic acid. Now, elastin is something very few people talk about. They talk about collagen to some extent, and hyaluronic acid comes into play because it's in most fillers. Most Restylane fillers are made of hyaluronic acid. Juvederm, all of that, they're all hyaluronic acid based, and that's a part of your inner, composition anyway. But, when you think about it, the same thing that happens to your lower jaw area, developing jowls, well, guess what? Your labia is shrinking too. And as you get older, hormonal changes happen, and, your vagina is going to be dry. It's not going to be as plump as it was. Sex is going to start hurting. Your clitoris is going to get smaller. Yes, it happens. So imagine that. So even your clitoris shrinks. It's like, we're just going to hell. So, yeah. I mean, let's call a spade a spade. Something magical happens at 40 and it isn't very positive now, is it? So I start to go, it's not pleasant. It's not pretty. So then what happens is you're getting tighter. Well, let me rephrase this. You're not getting tighter. With childbirth, you're actually getting looser, because as you pump those babies out, your vagina is stretched. And does it ever really come back? No, in most cases it doesn't. Never quite where you need it to be. Now, you can do some things at home on your own without coming into me that can help you, but they're only going to help you so much. For instance, Kegel exercises. When you tighten and relax your vagina, that sort of thing can help you to some extent with your pelvic floor, with incontinence, with the laxity of your vagina after childbirth, but it's not going to fix it. To definitively fix it, you need energy, and energy you provide by means of a laser. Now, there are multiple kinds of lasers out there. The one I do is a CO2 laser. The reason I do CO2 is because it literally, it sounds scary, but it resurfaces the inside of your vagina. So when, for instance, I ask patients, hey, do you have urinary incontinence? They say no. 99% of the time, they'll say no. Then I say, do you leak when you sneeze? Do you leak when you laugh? Can you do jumping jacks without looking down and making sure you don't have streaks going down your legs? Well, no, I do have that problem. I said, well, then you have incontinence, So that kind of thing you can fix different ways now. Your labia gets loose and floppy. It's not just your jowls, it's the labia too. So I have a subset of patients coming in for labia rejuvenation that are usually about 45 to 60 years old. Most of them are, in situations where they're getting divorced. Now they're getting out of the dating world again. So now a new person is going to be down under and they want to look good.
Right.
So I have them coming in saying, what can I do to fix this? My sex life was terrible in my marriage, but I don't want it to suck forever. So how do we fix it? So then, we talk about why they have issues and how we can fix them. So there's a lot that can be done now for both aesthetics and function.
I'm curious, obviously age, just for everyone, has something to do with it. If this may be like my own selfish question. I've had 3 C-sections. Does it happen later because I haven't had natural childbirth and I have a few more years to start thinking about it?
Well, you're lucky that you didn't have the laxity that came from passing, big babies, but you still have the hormonal issues though. So, when you are at a certain age and the estrogen starts to go, your testosterone levels may be too low because, we're females, but we still need a certain amount of testosterone. So it's that's why I do even hormone balancing and replacement in my practice, because so much of it is interlinked. Because I found that my patients were going to random places. It was too many cooks spoiling the broth. It was just too much happening because they were going somewhere for their hormones. They were going somewhere for their intimate health. They were coming to me for facial aesthetics. It was a mess. So now I can keep it in-house where I know what's going on with them. We know their micronutrient levels. We can test for those. How low is your vitamin D? How low is your iron? You don't want to have sex, but how anemic are you? I mean, it's more than just one issue. So what are your hormone levels? And, you'd be surprised, but not every gynecologist is testing for everything. So, hair loss, for instance, a lot of that is hormonal. So as women, 40% of us have visible hair loss by the age of 40. See, there comes that number again. So right here, I had a lot of recession to the point that I had a hair transplant. I was about 38, I think, if I remember correctly, when I had it. So, it happens. So much of it is interlinked that I find that sexual health, it begins metabolically, it begins nutritionally. It's so much of that. And So much of that is normal aging. And we just get used to the fact that everything goes to hell. We don't have to let it go to hell anymore. See, we can fix that.
Right.
And we can fix it earlier than you think is necessary, because then you really solve the problem before it becomes a problem.
So everyone talks about, or not, they don't talk about, they know about the O shot.
Oh yes, the O shot.
All like it was back, it reminds me of back in the day when Botox was like, ooh, hey, Botox. They didn't tell anyone about it. Now everyone's like, I had Botox, like they're talking about like, like I brushed my teeth today, which is how it should be. I mean, come on. So the O shot is one of the procedures that one can do to freshen up, per se, their vagina.
I love how you.
I'm proud of you, Dina.
She had a struggle to say that last word. Vagina.
3 times fast.
She's trying. She's trying.
Oh shit!
See, she's starting to blush. Now, when we started having these conversations, I said, Dana, we really need to talk to the women out there about this. And she said, I don't know about that. It's really not my thing. I'm a mom blogger. I said, yes, but moms have this problem. So she's getting there. She's getting there.
We'll get her there. We'll get her there.
We'll get her there. So the O shot is literally the orgasm shot. And like I said, for me, my study in rejuvenation began with hair, both for my patients and for myself, because, I don't want to go down without a fight. I'm pretty natural. This face has not been cut or messed with in any way. I do energy treatments all the time. I call them energy kisses. My face is kissed with energy all the time. But anyway, so rejuvenation, that's how it started. And Dr. Reynolds, the creator of the vampire facial. See, I went to him to learn how to do the vampire facial correctly and to get certified in it. So he taught me how to do the O shot. And initially I fought it. I said, I don't know why you're trying to teach me this. I don't do intimate wellness. He said, but you should, doctor. And, I realized that's kind of silly. Why am I not doing this? This is all linked. It's all rejuvenation. So I studied about this and I trained under him. So basically the same PRP that you hear about with skin and vampire facials is what we're using. So it's a quick blood draw. We take a little bit of blood out of your arm, just one tube. And so it's not a whole lot. We take it, we spin it down in our centrifuge in our office, and we get, PRP. Now, PRP is that what I call liquid gold. It's yellowish looking. It separates in the tube. You can see, I wish I had one to show you, but you have the red portion and then you have the gold portion on top, the yellowish portion. So what I do is I take it a step further. I convert it into fibrin matrix. Now, I know I'm making it sound maybe too technical, but really all it means is a stronger form of PRP. So PRP is great. I make it even better. And it has growth factor in it. And a lot of times, people get very scared of growth factor and growth hormone. And it becomes, very taboo sometimes. They think, oh, that's unnatural. No, your own growth factor is the most natural thing on the planet. We're not adding any chemicals to this. This is you being put back into you. See, we have the ability to rejuvenate ourselves naturally. And that's where I come in. So I convert it into fibrin matrix and I inject it into the clitoris. Now, the minute I say inject and clitoris together, I know that everybody clenches up, It sounds bad. It sounds wrong. It's like a needle should not be going near my clitoris. And I get that. But, I have done so many of these procedures and I have done them so well that we have become a center of excellence at Bawa Medical for P shots and O shots. Yes, gentlemen, P shots for the penis. It's a fair word here. It's for you and for the girls. So basically what I do is, everybody's got to have fun, right? So,
Father's Day gifts. Start thinking about it now.
I'm telling you, see, Jamie, we're talking the same language here. So basically, I have a technique whereby I numb the vagina and the clitoris so beautifully that I'm honestly telling you, I know this is a bold claim, but 100% of my patients say, when are you doing the O shot? And I say, I just finished. And they say, really? I say, really? And they don't believe me. So that's how painless it is when I do it. And so really, I'm putting that PRFM into the clitoris because it's going to do a host of different things. One is going to increase the size of the clitoris. Because if you think about it, the clitoris is a tiny little thing, like it's just sitting under the hood. And if it's really tiny, it's never going to pop out enough. See, it's just so tiny. But now if you make it bigger, it's going to force itself out just a little bit. Now, don't get me wrong. You're not going to have a tennis ball between your legs, but you know,
Thank God.
you don't need to worry. It's not going to make you look weird. But it's just a little increase in size, you know, and that little increase can go a very long way. Now, I think I should take this opportunity to discuss something that I face very often in my practice. And it's nothing to be ashamed about. It's a common misconception. A lot of women don't realize that we don't pee and have sex from the same hole. And that causes all kinds of confusion. So let's just talk basic anatomy. So there are 3 or 4 main things we need to talk about. When let's again visualize, let's just say this is the vagina. Right on top is your clitoris. It's sitting under the little hood that I said. So that's right up here. Right next to that is the urethra, where you pee from. And then comes your vagina, where the sex and the babies happen, right there. So the clitoris is right on top is where I'm injecting. And I also inject within the vagina itself. So the and this, by the way, is completely painless. Like I don't even need to numb this area. This is no joke. So the clitoris I do numb, but the anterior vaginal wall does not need to be numbed at all. So I inject there as well. Now that is a good solution for mild urinary incontinence or lubrication. It helps with that as well. So when I inject it into the vagina, it's helping with some level of tightness, some level of incontinence. It's not going to be a huge change, but it's a positive change. It's a good thing because it's helping your vagina rejuvenate itself. The magic happens in the clitoris. That's what the O-shot is all about, the clitoris. And that's the seat of the female orgasm. People don't realize that because, you know, women are getting very used to having lousy sex. They don't orgasm every time, but that's considered okay. Men orgasm every time, and that's considered normal. So I'm here to tell women this is not necessarily how it needs to be for you, because you need to realize that only 18%, that is 18% of women will have orgasms vaginally. That's just how we're made. So if you're one of the lucky 18, you know, we're all incredibly jealous if you go away. The rest of us need some help, right? So it is what it is. We're just being honest here. So we need help.
More.
Yeah. So we need to give our clitoris a little more attention, and you're stimulating it. You're increasing the response of the nerve endings. Now, here's a fun fact: the female clitoris has 8,000 nerve endings. 8,000. Now, if you think of how tiny a clitoris is, how tiny it is, 8,000 nerve endings. Now, do you know that a penis only has 4,000?
So we double them.
So we have double the nerve endings, yet we're not having orgasms all the time. They are. Does that make any sense at all? It doesn't, does it?
No.
No. So that's why the O-shot is such a spectacular thing. It's like God said, you know what, girls, I'm going to throw you a bone. I'm going to make your life a whole lot better. So we got the O-shot. So what we're doing is the seat of the female orgasm, the clitoris, is getting directly stimulated. So we make it bigger, we make it more vascular, we make it more sensitive, we make it do all kinds of wonderful things that it was always meant to do. You see? Right. So that's why the O-shot is a beautiful thing. And when I do it, it doesn't even hurt. So it's a win-win.
See, that's what's amazing. Jamie, you have to tell Dr. Bawa what you just messaged me.
I said, with women having 8,000 nerve endings, we're always superior, but we give in that.
We give in.
But we give in. Our behavior is, I mean, this is really a women issue, right? Like we sacrifice and we don't focus on ourselves. And so just even knowing that it's possible is pretty powerful.
Yes. And you know, the thing is that, you know, some of the men, not all of the men, but some of the men do try. But, you know, they're shooting in the dark, because if we don't even know that we don't pee and have sex from the same hole, we're not giving them a whole lot of good direction either, are we?
Right.
Right? So we can't have them help us if we don't even know our anatomy. So ladies, I'm happy to discuss this with you. I'm happy to do virtual consultations, whatever it takes. I'm not going to charge you for these, but if it means that we can talk and get you to understand anatomy, you don't even have to be local. I'm not even saying you have to be a Boca person. I'll just talk to you. I love talking about this. So the thing is, if you understand your anatomy, if you understand your anatomy, then at least there's some hope for the future. You can train your men to know your spots, but you got to know your own spots. See?
Right.
And that's where the O-shat comes in, and that's where the wing lift comes in. And people don't even know what the wing lift is. That's something they haven't even heard about.
I never heard about it till I started being friends with you. I'm like, I am learning way too much. Yeah.
Yeah. So if you Google wing lift and Boca Raton, I am the only name that will come up, or South Florida. I mean, because nobody else is doing them. So wing lift is labial rejuvenation, because like I said, your face is drooping when you get older, but so is your vagina. The outside of the vagina is drooping, and the plump, labia that you used to have when you were 20 is now shriveled. And okay, maybe not in your 40s, but the time you get in your 50s, 60s, 70s, it's getting worse and worse with every decade of life. So what we do is the same PRP, PRFM that we put into the clitoris or the penis, we inject into the labia. Because the idea of PRP or PRFM is to build tissue, build new tissue. So you're putting, this liquid gold into your labia, and it's going to build new tissue. It's going to plump it up naturally. Now we can, amp it up, and put it on steroids, because I can actually put filler in your labia. Crazy, huh?
You can make them fluffy.
I do make them, yes. So I put that, I literally take PRP and mix it with filler. I go back and forth between two tubes, literally mixing it like this. And I have, half and half in two tubes, and I inject it on both sides. And again, this is painless too. And Real Self, the cosmetic surgery website, Real Self, they called me and they said, Dr. Bawa, we know you do a lot of sexual health, and we know you do the wing lift and labial rejuvenation. How come you haven't posted pictures? I said, I don't want to get kicked off your site. How do you think, what are you talking about? They said, no, you won't get kicked off our site. We're asking you to post those. So I did.
Yeah, because they're a medical site, and people go to them to look for doctors.
Yeah.
So they want to see the before and afters and stuff.
Yeah. Mm-hmm. So, I mean, I'm always scared of what to post even on Instagram, and I'm not even talking vaginal stuff. So I post anything that you're getting all up in a tizzy half the time. And you're trying not to get blocked by them, or, put on, what can I say, on the bad kid list. So, so you never know. But Real Self called me and said, hey, put it up. I said, okay, will do. So I did. Who knew?
That is
so yeah. And then I do lasers with that too, because, the lasers, especially the CO2 laser, will basically go in and, like I said, resurface the inside. And that way it can literally, this is not exaggeration, because it's such a high grade rejuvenation, and it's not painful. It really isn't. I don't numb the inside of the vagina at all for it. So it sounds crazy, but it's true. The inside does not hurt. So I take the probe, I do it, 3 times. I go in and out, I do it at every level. So I put it all the way in. I take it around and I pull it out, take it around, pull it out, it's very cumbersome, but it doesn't take long. And it's not painful.
What does the CO2 do?
It's resurfacing it, so it just basically takes off the top layer. And it, again, same idea. It's helping you tighten the vagina back to a pre-childbirth state. So it literally does that. So I had a patient's husband bring me Godiva chocolate and an expensive bottle of champagne. This is no joke.
He knows.
Yeah. Yes, and you know that my staff got champagne and chocolates too. I mean, my bottle was the most expensive, but we all got champagne and chocolates.
He's like, I am bringing my wife back whenever she needs it. So I just have a quick question. We have to go to, I can't believe a half hour is gone already. But quick question for you. So when you do these types of procedures, just out of curiosity, how long do they last? Like, do you have to do them a lot? Is it like every 3 months? You know, like, because I know like with fillers, they go away after a little while.
Mhm. Well, the CO2 laser is actually very effective. Now you have to do a series of 3. One is not going to do enough for you. One does help a lot, but I don't like to mamby-pamby my treatments. I don't want you to have a little bit of improvement, but not really. I want it to last. So for definitive improvement, you need 3 CO2 treatments of the vagina internally. And then externally, you know, it's usually just elective. So you don't have to do the outside, but people are doing the outside because it looks better. It refreshes everything. If your face looks good, why not your vagina, right? So why not? You can do it now. So people are doing it. So, you know, it's not that you have to repeat it every so often. I can't imagine that anybody would really need to come back for at least a couple of years after they do 3 treatments. And if you have a significant problem, maybe you may need another couple treatments, but I have not seen where anybody's needed to come back after doing 3. For incontinence anyway. So I'm not saying it's the holy grail of all things feminine, but it solves more problems than you can imagine. You know, it tightens, it moistens, it makes sex less painful, it makes your vagina look better. And then, you know, as far as the O shot is concerned, you know, it's hard to say. One O shot alone can be very effective, but you can't overdo rejuvenation. So if your budget allows it, and if you can actually come into my office, more is better. Now, what is the limit? I don't know. There's really no limit to rejuvenation. It's your PRFM being put back into you. So I'm never going to tell somebody, hey, come back and get one every month. You don't need that. But if you were to get a few a year, if you wanted to, I mean, that's a good thing. You don't have to, though. One alone is helpful.
What's good about it, I feel, and Jam, I think that you're with me on the natural sense. It's your own body. It's your natural, it's your PRP that you're putting back into your body.
Yes. Yes.
So it's not chemicals or anything like that. So I can see where that's going. But okay, so we're
natural.
You're totally over the 30. And I'm so upset. But I want to get to my favorite speed round of questions. James, do you have any other questions before I go to the speed round?
It's going to require a part 2.
Okay. we're gonna have to bring you back for this one. Okay. So, Dr. Bawa, coffee or tea?
Tea.
Red or white wine?
White wine.
That one. What's your favorite flower?
Rose, red rose.
So when you are not rejuvenating vaginas and other parts of the body, what do you like?
I couldn't hear you. What do I do when I'm not rejuvenating vaginas?
Yes.
Okay. In a non-COVID world, when I'm not rejuvenating vaginas and penises and getting champagne from happy husbands, I like to travel. But, you know, COVID is really cramping my style. I love photography. I shoot with a DSLR. So I like to combine travel and shooting with a DSLR, ideally. That's my favorite thing to do.
That's awesome. So do you have a favorite quote?
You know, there are so many, but there was one that Coco Chanel said, keep your heels and your standards high. And I know I'm not quoting her exactly right, but keep your head, heels, and standards high.
And is there a particular author or book that you love that you would recommend?
You know, people don't realize this about me, but I have 2 degrees in English. So I am very much into Shakespeare and Thomas Hardy and Charles Dickens. So I am very boring in many ways. But if you talk about current authors, you know, I like stuff like John Grisham and legal thrillers and, you know, that sort of thing. I love that. I love reading autobiographies, learning from people who've achieved great things, you know, that sort of thing. So I love those.
Okay. And then one more thing, because then we totally have to, I feel so bad. So I put up your website and your Instagram handle. Guys, definitely go check her out. Listen, she's for lack of better terms, all balls to the wall. She's very straightforward. Dr. Bawa always tells you how it is. I mean, she explains to me everything about my profound treatment to like the T. She is very into educating her patients. And she's obviously, as you can see, has a passion in what she does. She is actually giving away a hydrofacial to one lucky winner. Do you want to give the details on that?
Sure. We have, actually, I'm also giving away one area of Xeomin, which is a $240 value. So I'm giving away two things. So anybody who attends my event on January 28th, we're having it at our office in Boca Raton, and we're following all COVID guidelines, so it's completely safe. We are offering the free hydrofacial, the free area of Xeomin. All I say is we'll be posting, Dana and I will be posting this on Instagram. And we just ask that you follow us and tag 3 friends, and that's it.
Yes.
That's all you have to do.
And you'll see the actual post that we're going to be asking you to tag on. I'll put it in my story as well as in Dr. Bawa's story. Dr. Bawa, thank you so much for being with us tonight.
Thank you for having me. I can't believe it's been 36 minutes.
I know. And you know what's so funny is I remember when I first met you and you're like, would you talk about, you know, like sexual? And I'm like, no, no, no. And we did it. Jamie, we did it. Jamie pushed me.
We did it. See, and you survived, and you're okay.
I didn't ask for a before and after picture. That would have really.
I'll text it to you. I'll text you a link. How about that?
Yes.
I've seen them when I'm in her office. The
Yeah.
before. Of course, I don't know who the patient is because of patient confidentiality, but I have seen a wing lift.
Yes, you have. And you know, the thing is, it's pretty impressive when you see the side that isn't done and the side that is.
I'm like, oh gosh, I gotta look at mine. No, but so once again, thank you so much.
Thank you for having me. It was lovely being here.
Thank you. Bye, everyone.
Great
Bye.
night, everyone.